All right, getting us started today with our first presentation, Dr. Bryan Born. Dr. Bryan Born is a chiropractic physician in Southfield, Michigan with 30 years practicing in the same location. He was educated at the University of Michigan and Oakland University and received his anatomy degree and doctorate at Parker College of Chiropractic in Texas. He has lectured across the United States and Canada since 1993, educating doctors and massage therapists. I present Dr. Bryan Born.
So we're going to talk about babies. My first patient last week was this young one who hadn't slept in more than an hour and a half in her young life at one time, and therefore the parents didn't either. So what I want to do is explain what does chiropractic do for that, and how can we help things like colic. So the first cell you have at the moment of conception, you have undifferentiated cells. I know that's a fancy word, but basically they mean they're all the same. They're not different. And each of those cells, we call them stem cells, can create anything, but they don't have the ability to do anything. They can't make anything happen. They can't function anyway. They just grow. They are basic cells. The first cell to become differentiated is the nervous system cell, not the heart. The nervous system it grows down through this like a hot dog in a hot dog bun, and it starts to form shoots like the branches of a tree coming out. And the first branch is the heart, and then the lungs, and then the liver, and then the kidneys, and then 2 legs, 2 arms, and that's what creates a human being. So it goes from stem cells undifferentiated to different cells, but what controls that growth from day 4 after conception is your nervous system. And the nervous system working properly will continue to grow and help you heal throughout your entire life, unless there's a problem. So I want you to feel the end of your nose, okay? So you got bone here, and then you get the soft part there. And I want you to push on your nose. That hurts, so it's sensitive, right? At the birth, in the labor process, 90 pounds of pressure is placed on the baby's skull. And then pulled if it's being supported or helped. What's 90 pounds? That's Rebecca. Rebecca, where are you? Rebecca is standing on your nose. Can you imagine? Just put your nose there and feel the pain in that. So that's the first day that this little child comes into this world, is that much pain. And then we call it colic and say, oh, they'll grow out of it. No, they got a headache. They've got whiplash. They've got neck problems. They're hurting. And what happens often is that the bones in the spine can get jammed. No different than an adult. They get a little bit tilted. But they're not all hard bones. There's a core of bone, but most of it is like the tip of your nose. Very soft, very malleable, very full of pain nerve endings. And it can get shoved into one position, and that can pinch the nerve. Now, we call it pinch. And a pinch, ow, that hurts. But it only takes the weight of a quarter to shut more than half the nerve signal off. So instead of getting full signals, you're getting half. Now, I know most of you, you're on a cell phone, and you miss one word, and you're like, whoa, wait, stop. What did you say? And you have a moment of indecision. You miss the second word, and you'd rather not talk at all. You'd say, look, I'll stop. We'll do it some other time. That's how impatient you are to make sure it works right. So if there's a little interruption in the nerve flow going to one part of your body, then that is a problem. The part of the body that I care about, which is why I'm doing all this, is going to the diaphragm, because that little nerve helps control the baby's breathing. And that's what crib death is. You get a little bit of distrust, a little bit of interruption in the nerve signals that go to the baby's diaphragm when the baby is sleeping, and they call that sudden infant death syndrome, or SIDS. Honestly, headaches, no one dies from headaches. They're painful, they're hard. I had a bad one yesterday, but that's not the problem. Colic, sleepless nights for the parent. But the doctors are right. They grow out of it. It's crib death, which is why I do what I do. So for the first 3 months of life, any child can get an exam and a treatment in my office, and probably some other chiropractor's offices at no cost. It is not worth the cost of having a problem and that child not getting the care they need. 1, 2 visits solves that problem. They did a 1,000-patient study in the Chicago University Hospital. Half the children got a chiropractic exam and treatment if needed. The other half were simply growing up. And no crib death for the entire study. I don't know why everybody doesn't know that, but I'm doing my best to explain that. Children could have exams. Now, how do you treat something like that? I mean, they're tiny. Excuse me, I didn't prepare and bring this up. We have technical tools now. We have specialized gear. So these are the bones in the spine of an adult. And this is a tool that I use to get these moving again. Now, they are the thickness of 3 business cards. That's the work that I'm doing. I'm taking this tool, sometimes over my pinky, and I'm putting it against the bone in the spine, and I'm moving it. Now, for an adult, it moves a lot more. It can move a lot more for an adult. But for a little infant, we can dial it down and be precise and analytical and move that bone just the point so it gets from stuck to moving again. And the amazing thing that happens is they go in crying, I make a little click, the baby jumps just a tiny little bit in the mom's arms, falls asleep, fills the diaper, and the parents go home happy. It is the most instantly rewarding thing I can possibly imagine. So that's chiropractic, and that is the essence of what happens with a little infant, and there's nothing more magical than that. It's science, it's specific, and it's functional. So I think that's all I have. And thank you for your time.